saying that I graduated from USF in 2017 with a Master's of Behavioral Health. I know that right now it's a dual degree program. My background is in research, so it's my background is probably similar in your background now, understanding public health, but also lending a lens on like human behavior and like psychology. So what brought me to this program was actually my personal background. I grew up in low income housing projects with immigrants and low income family. I was really interested in biology. I went to Cal. I studied integrative biology. I was in the research field in bioinformatics, but something didn't feel complete. I end up being like a medical liaison for my family, with my mom going through cancer, and I have also 3 sisters with disabilities, and that helped me see the health system and just the environment and community at large, and that redirected me to something more down the public health route. So I found the MSBH program. I really enjoyed just how they thought about public health and how they thought about health in general. They thought about it more holistic view. And so I did that, end up doing doing some research with UCSF, working at Zuckerberg San Francisco General, and now I work at First 5 Alameda County as a data analyst. So that is just a brief description of about me.
Thank you. We're excited to have you, and hopefully everyone else will love all your information you'll be able to provide. And then Daya, if you want to give yourself a little introduction.
Yeah, sure. So good evening, everyone. I'm Daya. So first of all, thank you to PHSSA for including me in this great event. I'm not sure if Sharon or Kayla knows this, but I was also a co-president of the Student Association back when I was in the program. So it's kind of nice to be here as a panelist, go full circle. So I currently work as a research scientist for CDPH, more specifically within the Office of AIDS, and even more specifically, part of the fiscal forecasting team. So ADAP is a program that provides life-saving medication to uninsured and underinsured people living with HIV in California. I work on the data side of things. So our program created like a transactional database system back in 2017, right after I graduated, actually. This was like my first job working in the CDPH. So the system, it collects a lot of client information, a lot of eligibility information, a lot of dispense history, and my job is to kind of take deep dives into the data and see what type of reports we can find, see what type of what clients are more vulnerable to, losing their eligibility for these governmental programs, things like that. So that's kind of what I do. So I was part of the USF cohort 7 on the San Francisco Presidio campus. I graduated back in 2016. I think back then there weren't too many focuses or specialties, so it was just the general. I don't think the program was around too much, but I am very excited to be here and be here as a panelist, and hopefully I have some interesting information that I can share with you all.
Great. Thank you, Glenda and Daya, for joining us today. And I did not know you were a PHSSA officer at one point. That is really cool. So I work with Daya at the Department of Public Health more closely before, but still within the same organization now. So thankful he was able to join us. All right, so to get started, you were able to submit any questions in the chat that you may have for Glenda or Daya about, their current position, their career in public health, or any insights on how they've applied their degree in the real world, or, any career changes that they've made. In the meantime, I'm going to start off with the first question. You guys can choose who goes first. As public health comes to the front of the world stage today, what opportunities do you think this will bring for recent MPH graduates or future MPH graduates? and you know, health professional graduates in general, as you know, they graduate or just in the future after, you know, we have some prospective students here, something they can look forward to also after they join our program and get their degree.
Sure. I don't mind going first. So given what's happening right now in the world with COVID-19, I think there's going to be a lot of opportunities in research. There's so much data that's out there that's publicly shared, and there's going to be a lot of epidemic forecasting that's going to be needed. There's going to be a lot of research that's going to be needed into looking for potential cures. So I think if you have the spare time, or if data is your jam, start looking into learning. If you don't already know, like, start playing with different types of models, start learning some more like statistical programs, like learn how to use R, SAS, SPSS if you can, and just start playing with it, because I really think there's going to be a lot of opportunities for taking these deep dives, especially in like epidemic forecasting, because like we don't know if this is going to be a regular thing, but it would be nice to have more hands on deck if something like this were to arise.
I see kind of an evolution of public health. When I was in undergrad at Cal, at the time the biggest issue was health insurance. And at that time, it was really difficult for people to go and get care because they didn't have health insurance and they were turned away from hospitals. And that led to people coming in last minute to emergency rooms and getting like more intense and expensive care. I mean, come out until later after doing research that type of model is actually burdening the public health system and the health insurance system. So then we had Obamacare, right? And then it opened up some opportunities by providing a more affordable health insurance, but also adding features to insurance that never was there before. And as COVID comes out, I see more of that evolution, because before it didn't seem that health care was important, and like your fellow person, whether they're like not related to you or related to you, didn't seem that important. But now we're shifting to everybody in our society is really important to take care of, because that could determine our health. We see with COVID-19, we see global health being at the forefront given the spread of the virus. So I see like a big opening on how we think about healthcare, and that opens even more opportunities. Daya, you talked about specifically the research part and the tracking part. So that part is very needed, and obviously as a data analyst, it's really relevant to my work. But for, I think, public health to move towards something that's more holistic to keep our society and even our world healthy, we need people at all fronts. Like we need people who are into the policy portion, because there needs to be a communication between like the research part and the policy and the implementation. Where I'm at First 5, it's kind of a blend of all of that, because we are an organization that uses public funds to provide public health support. And right now we're shifting away from not shifting away, but we are refocusing some of our funds on COVID relief and keeping programs safe and sanitary, and also abiding by shelter in place and social distancing. And that includes, even purchasing masks down to like, where can we get childcare? So yeah, I see a lot of things being up, one being data, but there's so much more for us to move towards a society that's healthier.
Great. Yeah, totally agree on that. I think in our response at the Department of Public Health right now, we're seeing that every program has something to contribute. you know, there's a lot of work to be done as far as the data and the testing, but then also like, what will we see in the coming months if we don't address early some of the socioeconomic factors that impact people's lives day in and day out.
Yeah,
Looks
there's a
like
need
we have
for even average folk to understand public health concepts. So thinking about it in more broader sense than like being in a public health type of organization.
yeah.
There is a question from Vanessa. She says, "Hi, Dea. For your position, what courses have helped you the most in your current role? How much technical depth did your employer expect of you when you first started?"
So for my current position, I would say definitely the biostatistics course, the epidemiology course, the program planning courses. Those three courses, I feel you have to have a general understanding, at least in the research position that I'm in. It helps to be an expert in it, but you don't necessarily have to know everything. It's not like an exam. You have resources at your fingertips. If there's ever some sort of model that you want to look up, you always can. So my manager, she is amazing, and Sharon can attest to that. She'll tell me what she wants me to learn. She doesn't tell me what she wants me to already know. So it's a great model for me to just try to learn as much as I can. And I don't know if every single employee is like that, but just as a person, you want to always be someone that wants to learn and do your job better. So her expectations for me when I started, like I told her how much like what type of projects I've done that involve like advanced statistics, and I didn't over exaggerate or anything. So it wasn't like I was. So I would just say I told her what I knew, and she told me. She kind of just taught me. She used to be a teacher back in the past. So in my situation, I think I'm in a situation where I want to learn a lot of the stuff. No, I don't know everything. I'm not an expert yet, but she's kind of like a tool in helping me become that expert. So I'm hoping you all will eventually have someone like my current manager that just wants you to learn and grow in your position. But those three courses, those definitely help because I use those every day, those tools every day from those courses. I hope I answered your question.
You did, thank you. And I figured biostats would be right up there at the top. Okay, thank you.
We have another question in the chat from Marisol. She says, "Thank you both for being here today. Glenda, I noticed in your bio that you worked as a research associate at UCSF. Was this a position you were able to get through University of San Francisco?"
So I actually grew into that position. I actually was an intern with MTPCCR. It no longer exists from what I know now. It's it was Minority Training in Cancer Control research program. And so it wasn't a very easy in. It's not just like I blindly applied and got it. The other research associates that I knew who worked with UCSF, it was similar that they had some research background. And I also, when I started as an intern, I actually had some research background. And then I was able to transition in, and the person I'm thinking about was able to transition in after having some research background. So I think that if you do want a position with UCSF, it's good to like at least explore and try to get a research background either by volunteering or like having a deeper dive in your projects that you're doing in school. And then like it's always really good to know people, and when you know people, it goes a long way, because half of the battle for the person hiring is figuring out who's in their pool and who is like the lowest hanging fruit, who would be able to easily come onto their project. So those are my tips for you, is try to get some research experience, and then also like know people, and that means putting yourself out there.
Awesome. All right, so our next question, so either both of you or one of you can answer, everyone wants to go first, is what has been the most critical tool or concept for you in navigating job transitions or taking on jobs where you needed to learn, refine a new skill set?
I think there's a lot of things, because it's really like, from what I'm interpreting from this question, it's how do you get a job and how do you refine your skill set, and that takes a while in practice. Daya could probably describe his experience, but it means like drafting your resume, looking at it, having other people look at it as well, finding opportunities that match your resume, and then also looking at that opportunity critically and see how you would be more fit for that, and then also being able to portray that in an interview. That on top of like already building a resume and skill set is the best way to go on finding jobs and transitioning to jobs.
Yeah, and I'd like to add to that. For me, I think you have to kind of be in the mindset, think of yourself like as a sponge. Like, you want to gain as many skills, you want to learn gain as many attributes as you can. So like when you see that job ad and you know you really want that type of job, look at all the required qualifications that they have, all the recommended ones. Usually, like you look at the required, you'll meet maybe 3 out of the 5 there. You'll get to the recommended portion, you just skip it. It's like, it's recommended, I don't need to know that. Take some time, like if you really want that type of job, take some time to learn all those skills, or at least make it your goal to know how to do it. So if you do get to the interview, you can at least talk about this. I'm not an expert yet, but this is what I've been doing. I'm trying to learn. I'm trying to gain these skills currently, and this is what I know so far. This actually helped me get the job I'm in right now. The requirement for my current position was to use SPSS software. And I used it a little bit in undergrad for some research projects, but I knew where to click the mouse pretty much. I knew how to get the results I needed. But the recommended qualification was to use SAS. And I was like, okay, I'll just read up a little bit on it. I paid, I think, $20 for this online course where there's emulators, so you don't have to have the actual software, and they will teach you teach you the basics. So I did that. I go to my interview, and the first thing they say is, so we're in a transition right now. We're transitioning from SPSS to SAS. I was like, oh crap. There goes all of my catered answers, throwing in SPSS. But I did a little bit of research and it actually helped me out. I was able to tell them, like, this is what I know of SAS so far. I am a little bit more comfortable with SPSS, but here I am. This is what I know about SAS. This is how I would do this project I did back in the day for grad school in SAS. Technology changes all the time. When I got the job, we started using SAS. So SPSS is kind of gone. We had to transition a lot of code over. And now we're not using SAS anymore. We're learning R. Or then we started learning SQL. And then now we're using R. So like, you have to be in that mindset of being a sponge. Try to learn as much as you can. Don't think of, like, when you see that job ad, don't think of it as, well, this is what I know and this is all I can bring to the interview. You have time in between. Try to learn as much as you can and try to get in that mindset is that you can always self-improve yourself. Sorry, I went on a bit of a tangent.
No, I actually really like that example, because I have a similar example. The job that I currently have, I went online and I found jobs that I would like to have, and I looked at their recommendations or what their recommended skill sets are, and I started to see a pattern. And then I noticed that a lot of them were talking about SQL, and I had SQL background, but I haven't touched it in years. So I actually decided to go online, find a free course, just review my SQL relearn SQL and review my old work, and it made a big difference in my interview and even in my job today. So.
Very cool.
Thanks, guys. It looks like we have a question on the chat, but now I feel like I need to go learn SAS and SPSS and SQL. I mean, I know Excel and Stata, but so here we have a question from Karen Molina. She's a prospective student. She was wondering, what are the unique aspects of USF's MPH program that sets it apart from other programs? And I think something there that could kind of help is like, what's one valuable thing that you learned at USF that has helped guide you in your career? Want to start off, Glenda?
Hands down, I would say the staff that was really interested in knowing what I'm interested in and connecting me with opportunities. The MTPCCR opportunity was presented to me by a professor there who knew I wanted to get back into research. So if I didn't have that, I didn't know if I would go down that route and end up working with UCSF and having my job currently. So I think that's one of the reasons that sticks out in my mind, but there are others.
Yeah, I'll definitely piggyback on that. I still keep in touch with a lot of the professors. And while I was a student there, they were so approachable. If you had a project you were working on, you needed assistance, they weren't shy in helping you, just trying to help you guide to make it the way you want it to be. It made me a better student, and I'm not afraid to ask for help today. And a lot of people usually are hesitant asking their supervisor, telling the supervisor, I don't know how to do this. Can you please guide me? So for me, yeah, the staff was definitely helpful. I follow some of them on Twitter, so it's a special type of connection you get with USF staff.
Before I went to USF, I was at UC Berkeley, and that was a completely different feel. There was a lot of people, with a lot of competition. A lot of times I would go to office hours and there were 20 other people who were waiting in there, and I would wait an hour to ask my one question. So that's very different, but that was also undergrad. So I don't know about grad school, how it would be for them. But what I like about USF, it feels more approachable, and the staff is more willing to work with you if you have special circumstances. Like when I was going to school, I had to take care of my mom. She was still recovering from her cancer. I still had to take care of my sisters who had disabilities, and I was working and then also going to school. So it was so nice, like, for them to talk to me about my situation and find ways that we could keep on going forward with my learning.
And I think I could piggyback off that and say that I totally agree with both of the stuff you guys have mentioned. And we actually have some of our USF faculty on the call here today. Dori Escobar is the PHSSA advisor. And we also have Dr. Kelly McDermott. And I believe I think we had Kelly L. Engel also join the call. And if there's other, faculty from the SF campus, maybe they could say hi on the chat.
I see Dr. Vion down there too.
Oh yeah, perfect. Dr. Vion's our program director. Hello. And so just a reminder, everyone, you can go ahead and ask questions on the chat. I don't know if there's a raise your hand feature on here, but if you want to ask your question verbally, go ahead and just let us know in the chat, and then we'll spotlight you and transition the question over. One question that I had, just kind of, with the theme of tonight, what does your day usually look like? And really, like, how often do things change from one week or 1 month to the next? Or does it just kind of depend?
I guess I can go
Yeah,
first.
you can go first. This way.
So I work in government. So there is a bit of a repetition that comes along with that, but it's a gift and a curse, because in public health you're never going to get bored, because you can always come to a solution going a different route, looking at it from a different perspective. But my day-to-day, there's a lot of meetings involved, and sometimes there's a lot of meetings you don't get to work on your actual research, but all those meetings are status meetings, or they're work groups for projects. So, you know, one thing that I'm proud of is, you know, at my workplace, we have timelines, we have a lot of due dates for all these different projects, a lot of different tasks that we want to get accomplished, and we have all these status meetings, and we always deliver our outcomes that we want to deliver on time. So there is a repetition in that, but I think that repetition comes with accomplishing those tasks that we want to get to. So every week or so, there might be different work groups that we work on. But for the most part, it's the same, but it's different because we're seeing our projects move forward. We're seeing them progress. So there's different topics on those same work groups as time progresses. But overall, it's government, so it's kind of the same every day.
Right now, it's really crazy for me, and every day and every hour changes because of COVID. We are doing a lot of kind of grassroots efforts, as well as like lobbying for things to change in our government, so we have more ability to help families. So right now, for me, it's constantly changing, and it's really frustrating sometimes. But I also am the type of person that doesn't like too much repetition. So, you know, there's like positives and negatives of everything. Before this, I worked also in government with Zuckerberg San Francisco General through the city and county of San Francisco, and there I did a little bit more repeated work, but we did have projects that spiced it up a little bit. And there's also, in the public health field, I feel like there's also ways you could create more projects for yourself if you want to add to your workload. And so it doesn't get too repetitive and boring if you don't want it to be.
Thank you. We have a question from the chat box. This is from Amelia. Is there anything that you would do differently while in the MPH program?
I think what I would do differently is be more involved in like some of like student organizations and putting myself out there even more. I know I did a lot of that, and I was able to open up opportunities for myself. But it's not just like about getting a job. It's also about learning and growing and expanding your network. So I think that's something that everybody could do more of.
When I was in the program, I think the Sacramento campus was just opening, or they were open, and it was a little complicated in getting classes there. If I was to go back, or if I was to go now, I would definitely try to see if I can take some of the policy courses at the Capitol at Sacramento. All of my courses were at the San Francisco campus. It would have been nice to kind of get that policy perspective before getting into government. But all in all, no regrets or anything like that. I think everything worked out pretty well at my MPH program.
Thank you both for your answers. So we have one comment from Kelly LeAngle and a question for Mercy. So Kelly LeAngle says, hi students. And Glenda, always nice to see you. And DK, it's so great to hear how well you're doing in the public health field.
Hey, Kelly.
And our question for Mercy.
Hi.
Um,
Sorry, can I speak for just a second? So thank you so much. Yeah. So it's Glenda I see on a regular basis almost. So I know how well Glenda is doing. But DK, it's really nice to see you. You were in my MPH 636 program planning class back in 2016, right?
Yeah.
And I know that you were co-president of the PHSSA when it was just the MPH students, right? And we had the separate MSBH student association that I think Glenda was involved in. So anyway, but it's wonderful to hear just how well you guys are doing. I think it's also really interesting to hear for both of you, your facility with data and analysis has been really important for your success in your public health job, right? And so I think that's a really interesting note. Sorry, I'm having a Zoom problem. So anyway, just hello and thank you guys for sharing your experiences with all of our current students. It's really wonderful to hear from y'all.
Thank you. Yeah, it's great to
Thanks.
see you. It's nice to hear from you.
Yeah. And I thank you for all your help when I was a student, and I thank you for your continued help to other students as well.
So our question from the chat box is from Mercy, who says, hello, what made you decide to go into the MPH program as opposed to other science or health programs? So whoever wants to go first.
I did my undergrad in biology, so I already came from the science side. So I had planned on going to medical school, but I chickened out. So I decided the next best thing was to, help people on a much larger scale. So that's what kind of drove me to go for the MPH. I feel like having that science background definitely helped, especially when it came to the biostats and epidemiology courses. Having that foundation there really helped me focus in on the new material there.
Dang, you're like my twin. So yeah, I was in the, I did biology as well. And then I was thinking about going into the medical field. I told you I was like a medical liaison for my family, and I saw how doctors work. And then I also saw the downfall of like human behavior, being like a person who's having empathy fatigue and not giving the best care, and also working in safety net systems. And I really thought about whether that's the right path for me. I had two master's programs I could go to. One that led to directly into medical school, and then USF, which brought me here. And I chose this because I visited the campus. I sat in and I met some of the students and some of the staff. I just felt so much more at home. And my interaction with the other program was very short and fast, and it just didn't feel right. I wanted to go in feeling like I had a plan, and I didn't want to go rush through it and then still feel lost. So that's why I ended up choosing USF.
Thank you, guys. Okay, and we have a question now from Dr. McDermott. I'm going to turn it over.
Hi, thank you guys so much. This has really been a pleasure listening to what your current experiences are and all the questions. So thank you, everyone, and thank you to the PHSSA officers as well. My question was really, you all have a really unique kind of perspective right now, and it's this, a couple years out. And so what would you recommend to the program, and what could we do to what else could we provide to our students given your perspective? So it sounds like both of you are using different software. Both of you are working in research. Are there ways that we could add to or improve our program that you think would even better prepare students going out into the workforce?
That's a great question. I think the program definitely fully equipped me for the workforce, but I do think it would be beneficial if someone is interested in research or just in general. I feel like now data is becoming part of everyone's lives. You know, Tableau exists, and it is not just for researchers or data scientists. It's for program and admin. I think it wouldn't hurt to add more exposure to being able to aggregate data, being able to, you know, do a few complex, you know, forecasting. It doesn't have to be too complicated, but I think just being a little bit more exposed would definitely be beneficial, especially since we're in an age where data is everywhere. Data is more accessible today than it was yesterday, without being, you know, without overwhelming the students. But that's the only thing that comes to mind to me right now. Just getting your hands on software like SAS or I would say R. In the government, it looks like there's being a shift. I can't speak for other industries, but it looks like everyone's kind of going towards their freeware for R. And it's free, so like there's one less barrier right there. But that would be my take. Just get your hands on a little bit more data, have everyone play with it a little bit. It doesn't have to be too complicated, but just being comfortable with data would be like the biggest outcome.
It's hard to say because we're both we're both in research and data analysis, so we could be like more cited to that. I think at the very least, like knowing various functions in Excel. I think some people might not be aware of like view lookups and like just simple functions you could do. So I think at the very least that, but I don't know if I would like stress that everybody be able to know how to write some programming in SQL or R or SAS, but I think that everybody should have an X factor. And the X factor means that you go a little bit deeper in some subjects so you have like a more solid experience in one thing. So you stick out more than other people who just go through the MPH program, don't really have any experience and go out in the workforce and try to find a job. I think that's harder versus somebody who comes, who has done like their own personal thing, whether it be graphic designing, whether it be like into policy, like having that X factor, and then doing their MPH and going out in the world and just having that solid experience and skill. They are more, will stick out more than other applicants.
Totally echo that. Yeah, that's brilliant.
Thank you. I'm gonna look up like more Excel functions. This question is from Marisol. Daya, did you do your MBA right after completing your MPH? If you applied right after, when did you begin the application process for a second degree?
I actually started my MBA, I think, into my first year of my MPH. I was doing both programs. I wouldn't advise it. It was a nightmare trying to juggle both of those. But I did learn a lot from my MBA. I did my MBA at Sac State. It was in healthcare analytics. So it plays hand in hand in what I do today. But I think I applied at the end of my first semester of my MPH. But yeah, I'm more, Sharon can share my information if you want extra details. I could definitely speak to you about that afterwards.
Yes, if anyone wants contact information for the speakers, just go ahead and send us an email, and we'll get to you. We have next question. Christina, did you want to read it?
Yes, sir. I'm still on mute. So we have a question from Elena Peterson. Hello, Daya and Glenda. From your experiences, do you have any tips on completing fieldwork projects? Specifically, how can students shape their fieldwork effectively so they can take more knowledge skills into their careers? Thank you.
I think first of all, it's important to select the right fieldwork placement for yourself. I think that if you want an easier transition into the workforce, especially if you don't have a background in public health, like selecting a fieldwork placement that has an opportunity that could open up when you're done, I think that gives like the easiest transition into a job. So that's starting off as number one. But for you to like find a workplace that fits you, you actually have to have interest in it. And then if you have interest in it, you're able to go the extra mile, you're able to impress them, and they'll be more willing to hire you if they have the ability to do that. Then secondly, I would say to get to know your I forgot what the name is called, your advisor at your field work placement site. Understand their communication style, understand how they like to organize, and how they would like to use the meeting time, because a lot of times you're going to find somebody who's going to be busy, but they're putting this on in addition to their work. So it's like extra work for them. So if you are passionate about your field work, you're interested in it, you do like a lot of good work, but then you also communicate well and have a good relationship with that person, that makes the project go so much smoother. And then also helps you get a job after that.
Yeah, and I don't have much to add to that. I would just say one thing that helped me during my fieldwork was setting the expectations. I did my preceptorship at the Veterans Healthcare Administration in Rancho Cordova at the hospital. I was with the systems redesign team, or I think they call it process improvement or organizational improvement team. Just set your expectations, let them know like what you're doing, what you want to get out of it, what you want to learn, and how many hours you're planning on doing. Because I've heard sometimes like some students are on their preceptorship, their workplace that they're at, it's just too busy for them sometimes. Just having those expectations set ahead of time, it really helps. It lets them know that you're here to work, you're not here to just get some hours done. That would be the only thing I'd like to add to that.
Great stuff. I think those of us in the midst of our field work right now during COVID are kind of going through a flurry, but all good tidbits to kind of keep in mind. I'm going to turn it over to one of our fieldwork advisors, Dr. Escobar.
Hi, everybody, and I really so appreciate your contributions, Daya and Glenda. Wonderful insights. And this was not my question, but I want to add a comment first to let everyone know that Glenda not only shares her insights regarding VMPH fieldwork from the perspective of the former student, but also as a former preceptor. Glenda has supported more than one student in the program in their successful fieldwork experience when she was with SF General Hospital. So thank you for that, Glenda. My question for either or both of you, Glenda and Daya, is hearkening back to an earlier question about why USF and how what you've learned at USF has contributed in your professional development out in the field. And I'm curious if the social justice and equity lens that guides all of USF's studies, research, and practice, not only in our MPH program, but throughout the university. I'm wondering if, as researchers, data analysts, do you find that applicable? Are you, how is that living out in your profession? Thank you.
I think it applies very much so. You know, when you look in front of your computer and you see all those columns of data, you can look at it one way, but there's hundreds of different ways to approach that data. USF really opened my eyes and in seeing disparities for what they are, you know, not looking for the Band-Aid solution, kind of going deep, get to the root cause of it, try to see, like, why is this trend actually occurring? What are some factors that affect it? I just, and it does sound corny, but I really do see the world differently after coming from USF. It really did open my eyes in a lot of different ways.
For me, I came from a community where barriers and disparities were very obvious. Like, I grew up in a housing project with mostly people of color, and we were low income, and seeing racism play out and seeing classism play out in my life and in my community. I knew social justice was very important in getting my community and people like me to a better place. And I know that USF is dedicated to that. But I think the way that I saw social justice playing out for me as a student is being treated like a human. When I walked in those doors and spoke to the professors and the students, and there are times that you'll still, being like a person of color, or, you know, whatever, like, if you, whatever unique identity that you have, like, you'll still have some gaps, and there'll be times where it won't be perfect, but as long as you could have a human interaction with somebody, I feel like there's an ability to create a bond and improve things. So that, I think that's how they provided social justice to me, is treating me like a human. And then as far as data analysis, I feel like this bridges the gap when you are at odds with somebody and they might not see something a certain way. For example, when I was at Zuckerberg San Francisco General, we wanted to think about who our target group should be, and there were so many different opinions about it because there's a lot of different vulnerable populations. And then what came to the front for me was minorities who, and specifically African Americans, who consistently show like having struggle the most and having the biggest barriers. And because there's the research and because there's data, I was able to explain my thought process and get people on the same page. So it makes it easier, even though there are gaps in people's understanding and the way and what background they come from, and just the way they believe.
Thank you both. I think you guys offer like really valuable perspectives that have really culminated not only your education with USF, your experiences, and also the work that you do and contribute to the health of all Californians and, you know, our families in general. So thank you all. We're getting to the end of our meeting here tonight, and we just wanted to take the time to thank you all for joining us. We hope that you're inspired by the work of Glenda and Daya to either keep you moving forward today, tomorrow, and or through the rest of your graduate program, or for those of you looking to join us, kind of motivating you just to get started. And also getting an insight into what a day in the life of not only health professional is, but also their experience as students.